Bryce Warner,
Hi, Bryce. Where are you from?
Salt Lake City.
Awesome. Why did you choose our office for your dental care, Bryce?
Because you guys have worked on me before and everything's gone great. I've had braces, I've had all kinds of fillings, lots of work done, always painless, always great. I don't know, great staff. Yep.
Perfect. Tell us a little bit about your experience with implants. How'd that go?
It's been great. I mean, I don't have a whole lot to say other than it was painless, easy and painless. I don't know.
Hey, thanks for taking a minute to watch this video. We want to talk to you a little bit about what to expect next with your implant process. Okay, so you may have had family members or friends with dental implants. You may have had your own implants before. Maybe this is your first time, but each implant is different. So even if you have or you know someone who has had an implant, each case is different. Treatment can go from 1 day to 7 months. That's quite a range, okay, some even longer. 1 day means you have all or most of your teeth taken out. We put implants in the same day. You leave with bridges, okay. Yes, it can be done in 1 day. It's not for everybody. In fact, it's probably not for most people, but that is an option. And then there are follow-up visits after, okay. The average implant we do usually falls between a 3 to 7 month period, okay. If you have a broken tooth or a tooth you can't save or a tooth's already missing, okay, we put the implant in and that's just a new root to replace the root of your tooth that's gone. It takes 3 months for that root to fuse to your bone, and then at the end of that 3 months we can start the process of making a tooth to attach to it, which takes about another month. So that puts us in the 3 to 4 month range. Now, if you have a tooth there that has to come out and we have to put bone in there and let that heal for a little bit, we want to do that for 3 months before we even start your implant. So that's where we get more into the 6 to 7 month range. So if you're already missing a tooth, or if it's a tooth we can replace at the same time we take your implant out, 3 to 4 months. If you have a broken tooth that needs a bone replacement for 3 months, then you get up to the 6 to 7 month range. All right. Now, we do offer sedation. Lots of our patients like sedation. There's some pills we give you that make you very, very relaxed if you don't want to hear or smell or see anything. All right. But regardless, we will numb your mouth up. So that's what to expect before. We'll numb your mouth up. You'll leave numb. Overall, you can chew and eat. Many people are surprised that getting an implant is actually much easier 90% of the time than having a tooth taken out. Will you be sore? Yes. Feels kind of bruised, may have some soreness, but the nice thing, the way we put implants in, there is very little bleeding, if any, okay, so you might have a little bit, but don't expect too much, okay, whereas when you have a tooth out, sometimes there is a fair amount because of infection and other issues. We don't have that with implants, okay. So make sure you eat before your visit, healthy diet, drink lots of clear fluids, make sure you're eating a well-balanced diet. If you're vitamin deficient, if you're not eating well, if you're smoking, consuming alcohol, okay, not only can those kind of things void your warranty, but most importantly, you may have to go through the procedure multiple times, okay? So let us know as you have medical changes. Some of the vitamins like vitamin D, calcium, potassium, if people are low on those, they can reject implants or not do as well. Even if you're taking a supplement, okay, it's still good to check with your physician, and if you're taking supplements, make sure you're eating them with food that contains good fat so you actually absorb those supplements. Lots of people take supplements with water or orange juice or coffee, and they go right through your system. To absorb those vitamins, you need to be eating good foods. You should eat the night before, eat the morning of your procedure, okay? Please don't come on an empty stomach, unless you're specifically told to, which 99% of the time you will want to come have eaten something, okay? The night before, take ibuprofen or naproxen, which is a leave. If you cannot take those, you can take Tylenol and then take one the morning of as well, along with any other prescriptions we gave you, mouth rinse, sometimes antibiotics. Sometimes we don't do those till after, just depends, but you will get those instructions. Just make sure you read them ahead of time so that you're prepared. If you're having sedation, you will need someone you know and trust to drive you home. A designated driver. Can't be Uber or Lyft. We need someone that you trust to be able to take you home. But our patients love it because it's comfortable and very safe. All right. So you want to arrive a few minutes early. Expect to be numb. You can usually chew and eat that night. After a couple weeks, we'll check it, make sure everything's doing well, and then we'll kind of map out the next few steps in the process. All right. But once you come in for that visit, we may take an X-ray and let you know what's next. Okay. And then for the next 3 or so months will be kind of a waiting time. You can have other dental work completed during that time, or other medical procedures, totally safe. Okay. From a long-term standpoint, with an implant, you will want to floss it and or use a water pick or air floss every day. It's like a high-performance vehicle that needs oil changes and tires rotated. Okay, an implant is not a one and done, right? And we've had patients referred in here, or people who have left for long periods of time and come back that have not maintained their implants, that have had the whole thing need to be redone again. Okay, because they don't have a lot of feeling in them, you could have problems and not even know it. So make sure you're maintaining them, seeing us regularly for checkups. Okay. Now, if you got one of our lifetime warranty implants, as long as you're seeing us every 3, 4, 6 months, depending on your preventative schedule, that implant will be warranted for life. As far as something chips, cracks, breaks, discolors, you don't like the shape, we'll take care of that for you. Okay. So let us know. Also, with any of our implants, for the first 4 months, if you need an adjustment, something checked to buy, there's no cost for that regardless. Okay, after 4 months, there may be an office visit cost or something, but depending on which implant you pick, the warranty will be extended as far as repair, replacement, those kind of things. Right? So 3 reasons that people like to do implants. The first one is they look and feel just like real teeth. Okay, so your friends won't know they're fake, your family won't know they're fake, and we're not going to tell anybody, all right? It's our secret. We'll know, you'll know. We won't tell anybody unless you tell them, okay? That's up to you. But they look and feel just like real teeth. The other part people love is no cavities and no root canals. We know that in the dental office, root is like a 4-letter word, okay? So you probably don't like to have these things. Most people don't. But with an implant, you cannot get a cavity, you cannot get a root canal. Now, you can get gum disease in an implant, which can be a silent or quiet or more hidden disease that can cause your gums to shrink around your implant and it comes loose, right? It'd be like taking the dirt out around your mailbox and it comes loose. You don't want that to happen. So floss, brush, drink lots of water, professional checkups. In the long term, eating healthy, okay? If you have any diet problems, health problems, you're going to want to pay attention to that because it can cause problems to your implant, okay? So they look great, they feel great, no cavities, no root canals, okay? And then they last a long time, all right? Which is what people really like. So regardless of which implant you pick here, it's probably going to last you many, many years, all right? Sometimes certain parts need to be adjusted or certain things need to be replaced, but as a whole, the implants generally last many years. So hopefully this helped kind of walk you through the process of what to expect next. Okay. If you still have questions, ask a team member. We will give you a paper with a written handout of instructions and what to expect next at each visit. Make sure you take those with you and read through them. One of the common things we get is patients will not know what they can eat that night, not know when to take what medications, and not know how and when to use a sedative. So we will give you those instructions, but we realize it's a lot of information too. We're prepared to help you, so please call us with questions in advance so that we can give you the best care possible, make your visits as comfortable as possible, and we look forward to helping you build a smile that lasts a lifetime. So thanks for watching.
My name's Janice and I'm a patient of Dr. Williams. I was referred to him by my previous doctor, and when he retired, he recommended Dr. Williams. I've had an implant and it was no problem whatsoever. And unlike the first experience I had with that, I came with a great deal of fear, but when I come to the dentist anymore, I'm not afraid, and I feel confident that they'll do a good job. I would recommend this dentist to anyone.